It was just kind of the unknown, because when you talk about the inner ear, that's kind of a sensitive area, and you think, oh boy, what kind of tests will they be doing? My fears were soon put to rest.
My main concern was, what were they going to do to me? Were they going to spin me around? Were they going to make me more dizzy? No, it was very comfortable, and the testing was very thorough.
Balance disorders are caused by a whole host of different problems, and when a patient is referred into our practice for evaluation, as part of the assessment, we have the patients fill out a comprehensive questionnaire to help with the diagnosis. Based on the in-office interview and examination, I then will decide whether we do certain types of tests or they do have a complete assessment. Through the assessment process, we help the referring physicians delineate what the proper care is from there. Keep your eyes right at my finger.
I came to the Hearing and Balance Lab because my doctor referred me to Dr. Mallahan. My visit to Dr. Mallahan was very comfortable. They greeted me well. When I did go back to see him, everything was explained to me. Nothing dramatic was done as far as, like, I thought, spinning me in circles.
When I began having troubles with vertigo and went to the doctor, and after the MRI, they suggested coming to the Hearing and Balance Lab. Dr. Mallahan was really good about, before we started, even explaining step by step what he was going to be doing. And during the test, each step of the way, he'd say, now that part is done, and now we're going to do the next step. And so I knew exactly what was coming. There were no surprises.
Different steps in the process for the assessment. One will be a postural assessment, perhaps, that the patient will undergo. We'll have a belt that holds them in place, so falling and getting injured is not going to happen. We'll have them stand on a foam surface. We will have them do different movements and record their postural sway. Excellent, that looks great. For part of the VNG examination, and VNG stands for video nystagmography. Nystagmus is an eye movement that we're able to record with the high-tech infrared video cameras. And the computer helps us with analysis of those eye movements. Good. Keep going. One portion of the VNG evaluation we may employ is a task called calorics, where we'll introduce warm and cool air into the patient's ear, which stimulates the vestibular system, the inner ear balance system, which then stimulates the eyes to move. And we can record that, and it allows us to assess the performance of each individual system. Another task that we may have the patient undergo is called a VEMP, which is vestibular evoked myogenic potential. We put a sound into the ear, and with recording electrodes on the patient's head and on their neck, record another inner ear portion of the balance system and see if it's functioning normally. Excellent. It is very common at the end of the evaluation, the patients say, man, this was a whole lot easier and less of a problem than I had feared. Right at my fingertip.
The doctor did a great job of making me feel very comfortable with all the testing that did need to be done. I would highly recommend anyone come here.
And I'm a grandma with 7 cherished grandchildren, and vertigo and playing with grandchildren just are not compatible. So I'm really excited.